Brooklyn Independent Television.
Coming up on Healthbeat Brooklyn, we meet up again with VELMA, who's hoping the Wellness for Life program will help with her weight and her diabetes.
What does that tell you per serving?
This time she's getting very specific advice on how to be a healthier shopper.
That's a lot of sugar. That's a lot of sugar.
Okay, I'm going to start scanning you now.
Bones, especially for women, can grow weaker with age, possibly leading to osteoporosis and the risk of fracture. That's why doctors recommend a bone density screening.
It's totally pain-free, doesn't require any interventional part on the patient, and they feel nothing.
And cervical cancer normally hits women in their mid to late 40s. DJ Juicy was much younger than that.
It didn't seem real. I couldn't believe that it happened to me.
But with good medical care and the right support groups, she's here to tell a survivor's story. All this and more on Healthbeat Brooklyn.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. A couple of months ago, we met the folks who run the Wellness for Life program at Brooklyn Hospital. Their mission is to help people use better nutrition and exercise to lead a healthier lifestyle. We also met a woman named VELMA, who's hoping to not only lose weight, but get control of her diabetes and maybe get herself off the medications she takes for her disease. Recently, Healthbeat's Tati Amara was there as VELMA went shopping for the kinds of foods that will help her achieve her goals.
I would love to just get off insulin completely.
You may remember VELMA MULLEN. We introduced you to her a couple of months ago as a member of the Wellness for Life program at Brooklyn Hospital.
She seems to be ready to do it, and now she has the tools that she's able to do it. The heading says plate division is the secret to success. So when you divide your plate, half is veggies and fruit.
She's down 4 pounds since working more closely with nutritionist Karen Congro, but still wants to lose more weight to reach her goal.
It has not been easy. I've been trying. Probably if it had been easy, I probably would have lost more weight.
And at this point in her journey, reading nutritional labels and tackling the food exchange list used by diabetics is her next hurdle.
I think the point is not to think that you could achieve everything at once, that it's little by little. You're going to look at the soup and say, does it have beans? Does it have chicken? How much vegetable does it have? Is it starchy vegetable? And sometimes the beginning is slow, and things will pick up once you really get all the facts in.
To make sure that VELMA gets all the facts, Karen decided to take a hands-on approach to shopping for food.
And how many teaspoons of sugar?
5.
Okay.
That's a lot of sugar.
That's a lot of sugar. So you see why these are not the best choices.
No.
Okay? So the better choice is the plain yogurt with your own real fruit,
yes,
whatever that happens to be.
In addition to the sugar content of yogurt, a big question for VELMA, they went over other key points for her to look out for when shopping.
To take one of these with your apple, and you'd have a really good balanced snack.
Oh, I could take that with an apple.
Sure. So this is a little better than the average butter. It's a spreadable. This is something new. Butter with canola oil. So this might be your choice.
They also went scouting for foods that are high in sodium, a big enemy for VELMA's diet.
That's why I don't eat the canned soups.
For the most part, unless they say low salt, you're probably going to see a high salt content. Let's take a look at this one. Well, this one's much better.
Oh, yeah.
290 grams. Now, these are bouillons, but again, you want to look at the salt content. What does that tell you per serving? 1,160 grams.
Oh, no, that's too much.
That's your whole day's sodium allotment.
They even managed to fit in solutions from the elusive deli case.
And do you see any free foods here? The mushrooms?
Mushrooms.
The peppers?
Yes.
So those are, and the tomatoes. If you're just using a small amount of tomatoes,
Walnuts
Could be a fat exchange.
Okay.
So can the almonds. It's just a matter of knowing how to put these combos together into a whole meal. Okay, how does that sound to you?
Sounds good. Whole grain pasta.
Velma told me her biggest lesson of the day came from a box of pasta.
The Healthy Harvest up there.
Yeah, they have spaghetti and macaroni. 41 grams of carbs. What does that tell you? You'd be eating less than what they call a syrup.
Yeah.
Today was a breakthrough for you, I think, in many ways.
Yes. I understand a lot more than what I did, and I know from what she explained to me today, and it seemed easier than me just sitting at home, reading all of this stuff over and over.
Now, with a better understanding of how to get to her goals, Velma showed me what some of her goals are.
At the time. So I said, this is cute.
It is cute. And this is what you're going to get back into.
This is what I'm going to get back into and have them taken in. So
I think in the next few months she's going to do very, very well. Everything will accelerate once she has the basics down pat.
And we'll continue to follow Velma's progress. For Healthbeat Brooklyn, I'm Tati Amara.
You're getting there. You are getting there. I see that you are.
Does it seem like more and more children have allergies today? Take food allergies. The Centers for Disease Control says that from 1997 to 2007, the prevalence of reported food allergy increased 18% among children under 18. Is the key word there reported? Are we just more aware these days, or has something else changed? The American Academy of Allergy, Asthma, and Immunology says that in a 2009-2010 study of more than 38,000 children, 8% have a food allergy. That's almost 6 million kids in the U.S. Those kids are 2 to 4 times more likely to have other allergies, as well as conditions like asthma. And are there additional emotional and social costs for these children? I want to welcome back someone who can help us with these questions, Dr. Michael Lanigan, Medical Director of the Urgent Care Center at Downstate Bay Ridge. Thank you for being here.
Glad to be back. Thank you.
So, is the key word reported? Are there more allergies, or are people just more aware of them?
Well, I think it's a little bit of both. I think people are definitely more aware of their bodies and disease in general. Obviously, with the internet and other information sources available, they're going to increase their awareness of things like this. Also, there may be, in fact, be more diseases and more allergies out there due to the way foods are prepared and that sort of thing.
And one of the questions that I was thinking when I was looking at this is, do you ever remember going to the doctor for an allergy when you were growing up?
I didn't per se, but I did suffer from some seasonal allergies, which my father suffered from more severely than me.
We'll get back to the relationship between you and your father, but I just don't remember a lot of kids any kids, let me be honest here, going to doctors for allergies when I was growing up. But of course that was a while ago. So it's more aware and more allergies. What are the usual presenting symptoms for children with allergies?
Well, it could be anything. As with most things, it's a continuum, the most mild being things like sneezing, watery eyes, runny nose, which can be, really annoying and, borderline debilitating, but aren't life-threatening, of course. Next up, you may see stuff like a rash, and that could be anything from, just a regular old skin rash with some redness to actual hives.
You mean hives?
Yeah, actually, you can have the diffuse sort of red rash. Hives are sort of, we think of allergies in particular when we see hives, and we worry about something that we've been exposed to. Then you would think of terms of things that might affect our breathing, such as our throat tightening, wheezing, and difficulty breathing. The worst part might be what we would call anaphylaxis, and that usually
Would you just explain anaphylaxis for the people who may not understand the seriousness of that allergy?
Sure, I'd be happy to. Anaphylaxis is and can a life-threatening issue. As well as difficulty breathing, it can cause a circulatory collapse, leading to hypotension and if
loss of your blood pressure.
Absolutely.
And to death.
Absolutely.
I have to interject this here because of some serious issues that I saw in my practice when I was practicing, as well as some personal ones, that I'm aware of a situation where a person was not actually eating what they were allergic to, but handled the dishes and rubbed their eyes.
Right.
And ended up in the emergency room.
Yes.
So that's a food allergy that's taken to extreme. What are the usual foods that people are allergic to? Let's start with children.
Well, children like everything, so we have to keep our eyes closely on them. Any fruits and vegetables can be a cause. Strawberries are always one I hear about. And as we were discussing ahead of time, celery has been shown to be a culprit that's highly allergic. Any nuts, of course, we think about like almonds, peanuts, very enjoyable to eat, but some people really can't be around them. I have a personal friend of mine who can't even be around peanuts, even in the room.
The air,
yes,
even
in the room, exactly.
What about seafood, shellfish?
Yes, that's another one that's seems to be very all or nothing. Either you're not allergic to it, but if you are, usually the manifestations of it are very serious. And again, even if shellfish is around, even if the liquid has gotten onto the food, or food has been cooked with some element in it, those people can react very strongly.
Let's go back a little earlier, because we started with children, but infants have allergies, sometimes to their formula.
Absolutely.
And how does that manifest?
It can manifest in regurgitation and vomiting of the formula. To some of the things I mentioned, you can get rash and those sorts of things. And the toughest thing for the parent is deciding, is this an allergy? Milk allergy is a very well described issue in pediatrics versus just other things going on like reflux or another more serious GI disorder.
I mentioned earlier that there could be some emotional. We know about asthma and the role that emotion plays. Mm-hmm. What about some of the other emotions or challenges that children with allergies may have as they get older and they're going to school, for example?
Right. Well, as they move along, they're going to meet new kids who aren't familiar with their situation. Maybe they didn't grow up with them in elementary school. So that's sort of an area of susceptibility for them if a child sees somebody react strongly to something, a food or something like that. It sort of leaves open an opportunity to get teased or needled otherwise, and that's tough to deal with. In addition, they can kind of be just nervous and on edge because they may not know what might make them react. And stigmata of, say, having to carry an asthma pump around all the time. I know I watch my kids' cartoons. They even make fun of that in some of the things. Here's the kid who has to carry the asthma pump all the time. Or even carry an EpiPen if their allergies are serious enough.
Exactly.
So having to go everywhere with those things always at your disposal, that can change your life.
We were talking about the foods that are brought up often in terms of allergies. We missed one very biggie. And when I was thinking about kids and going to birthday parties and so forth, chocolate.
Yes, absolutely.
And imagine a child going to a birthday party and the cake is sitting there and,
yes.
and all the things that could lead to. So what is it that parents need to think about when they have children who are allergic? What kind of precautions should they be taking? Well, you already mentioned a couple, but I'd like you to reiterate them.
Sure. The first thing is exposing them to them. Now, as I said, there are things that promote sort of a less serious exposure, but again, as you and I were talking ahead, food allergies can be very serious, and you can't really be suppressed. You can't get shots, in other words, to make them go away.
So once you have a food allergy, all you can do is?
Avoidance.
Avoidance.
Absolutely.
Okay. What else can they do?
Well,
you mentioned the EpiPen.
Right. If their allergies are severe enough, you just have to be prepared. So have your asthma pump, have your EpiPen, have your Benadryl, whatever is necessary to, take care of the problem should it arise. Also, if you're not sure your child is having an allergic reaction, or maybe they've had a milder one at the past, but this one seems more severe, don't hesitate to seek medical attention. What's the worst thing that can happen?
Better to be wrong.
What's the worst thing that can happen? You go in, you stabilize things, everything's okay, you go on your way. But it could be something more serious. Because as we know, in a number of allergies, the exposure, each time you're more exposed, gets worse.
Gets worse.
Right.
And the other thing is, what about when you're introducing new foods?
Well, one strategy I tell parents is if you yourself are allergic or your child has had some food allergies in the past or even medication allergies, if you know of these foods we talked about earlier, strawberries, nuts, chocolate, as you said, be around. Make sure there's a grown-up around. Make sure there's somebody around that could deal with an emergency situation should it arise if your child, in fact, does have an allergic reaction.
Thank you so much for being here. We're going to have to leave it at that today. Thank you.
My pleasure.
As a child, were you constantly told to finish your milk because the calcium would make your bones strong? Americans' consumption of milk has fallen steadily for decades. Could be too much competition from soda and juice. There are other factors, of course, but too many of us, especially women, aren't getting enough calcium, and our bones aren't strong enough. Having weak bones, a condition called osteoporosis, can cause fractures, which can mean a major loss in quality of life. Healthbeat's Sherry Carabin wanted to find out what preventive measures can be taken.
Most of us assume that our bones are strong enough to carry us wherever we're going. But how can we be sure? Recent statistics from the National Institutes of Health show more than 40 million people in the United States have or are at risk for osteoporosis due to low bone mass, raising their risk of breaking their bones.
Hi, my name is Georgia. I'll be doing your DEXA today, okay? What I need for you to do, you're gonna lay on your back.
One way to get a handle on the problem early on is by undergoing a bone density test or scan.
Now, I'm gonna get something for you to put your legs on top of.
A bone density scan is a procedure that we employ in radiology to measure the actual density of the bone itself. And we focus on the spine and the hip. And that gives us an indication of the susceptibility to a fracture, the potential risk for fracture. You see a T-score value is what we base it on. You also look at the Z-score.
In mid-March, 56-year-old Park Slope resident Daisy Ramirez had the test done for the first time at Brooklyn Heights Imaging on Atlantic Avenue.
I have pains, my legs all the time. My neck hurts me a lot. So the doctor sent me for a bone density.
Okay. And are you right or left-handed?
Right.
While osteoporosis can occur in both men and women at any age, it's most common in older women, especially those who are thin, have a small frame, are white or Asian.
People that are on steroids, people that have rheumatoid arthritis are at risk for the loss of bone mineral.
Other risks include having a family history of osteoporosis, as well as not getting enough exercise, smoking, and drinking excessive amounts of alcohol.
We don't see a large population of male patients getting bone density scans. It's approved every 2 years by Medicare for women. But there have been other studies done recently that show that there's not much of a change over a longer period of time, so it may not be necessary to do it as often.
Okay, I'm gonna start scanning you now.
The test is simple and painless and usually takes about 10 minutes to complete. The amount of radiation the patient is exposed to is much less than what's emitted during a chest x-ray.
I thought it was going to be worse, but was okay. I thought they're going to use a needle or something on my bones. So I was scared, I was nervous, because I didn't know how it's going to be the test.
Turn this leg inwards, okay.
Based on the results, a radiologist can determine if the patient's bone density is normal for someone that sex, age, weight, and racial ethnicity. The radiologist can also detect osteopenia and osteoporosis.
Osteopenia is a mild loss of bone density, and when it becomes more profound, then it's defined as osteoporosis. Osteoporosis, when that condition is diagnosed, the patient is much more prone to the potential of developing a fracture in the spine or elsewhere in the body.
If someone has a bone density scan and there is a problem, what can be done?
There are means to treat the patient and improve the bone mineral, the bone mass, with drugs or calcium supplements.
Lifestyle modifications are also important, like eating more dairy products, green vegetables, certain fish, and some fish oils, as well as doing weight-bearing exercises, quitting smoking, and cutting back on alcohol and cola products. Calcium supplements should include vitamin D, which helps the body absorb calcium and minerals. In cases where the patient does not yet have osteoporosis, these changes, along with supplements, may be enough. But one thing is certain, the earlier a problem is detected, the better.
There you go. Let me take this out of the way. I don't want you to hit your head.
That's why Daisy Ramirez didn't put off having her test done and plans to tackle whatever problems might be discovered right away.
All right, put your shoes on.
This is Sherry Carabin reporting for Healthbeat Brooklyn.
Getting cancer at any point in your life is tough to deal with, but even tougher when it happens years before the statistics say it's likely to occur. I'm too young for this is no doubt what comes to mind. And in fact, that's the name of an organization for people under 40 who have cancer. Healthbeat's Erica Robinson introduces us to a young woman who belongs to that group and who wants other young women to know how they can avoid becoming members.
Emily Rubin knows how to get the party started. The 33-year-old DJ says her passion for music started during childhood. She grew up in Brooklyn during the hip-hop era. Rubin now goes by DJ Juicy.
Before I ever thought I was going to become a professional DJ, it was like originally it started as Juicy Jew, and then it's sort of stuck, and then it evolved over time to become Juice E, which is kind of a throwback to old school hip-hop.
Rubin is not just a DJ. She is also a cervical cancer survivor. Every year, approximately 13,000 women will get cervical cancer. 4,000 are estimated to die from the disease.
Randy Crawford.
But the majority of women diagnosed with cervical cancer are in their 40s. Rubin was only in her 20s. At 23, she was diagnosed with the human papillomavirus, most commonly known as HPV.
I went for a regular pap screening, and I came back with HPV, and I completely freaked out because at that time nobody was talking about HPV.
Dr. Mary Fatehi, a gynecologist at the Long Island College Hospital, has been practicing for 13 years. She says that being diagnosed with HPV is like getting a cold.
It's just like having colds every single winter. That's a respiratory virus. You can't avoid getting colds because there are too many strains of the respiratory virus. But as soon as you make enough antibodies to clear that cold, then you're immune to that particular virus until another strain, you're exposed to another strain, and then you have a new cold. Okay, same thing with the human papillomavirus. Once you make antibodies, you're immune to that particular strain, but you can be exposed to another strain.
Dr. Fatehi says vaccination is key in preventing the development of cervical cancer. She recommends all young women to get the HPV vaccine.
There now is available a vaccine. It doesn't protect you from every single virus of HPV. There are over 100 strains of the virus. Some of them cause warts, but most of them don't. So most of us have no idea we've ever been exposed to the virus. The vaccine only protects against 4 of those strains. There's 2 that are associated with 80% of cervical cancers and 2 that are associated with 80% of warts. So that's not 100%. So the vaccine won't prevent every single cervical cancer.
When Rubin developed HPV, there was no vaccine. She continued to get her regular checkups to monitor the disease, but abnormalities continued to show up in all of her exams. But she was told she was too young for cervical cancer. 3 years later, she was positive for the disease.
I was terrified. it didn't seem real. I couldn't believe that it happened to me. I've been healthy my entire life. I'm a fairly healthy person. I was in decent physical shape other than that. It was a shock.
After 2 comb biopsies to remove part of her cervix, she was told she was cancer-free. 4 months later, she found out that the cancer was still there.
For about 4 months, I was really happy because I thought I was cancer-free, and I went in for a follow-up visit with another doctor. And as soon as I walked into the hospital, the first thing she said to me was, "I was looking over your pathology, and I think you still have cancer." So the world kind of came crashing down on me at that point, and I really kind of lost it.
RUBIN had 6 months of radiation and 4 months of chemotherapy at the Brookdale Hospital. It was a tough time for her, but she did not let it interfere with her DJ career. Tony Cortez, a bartender at the Vodou bar, says he has watched RUBIN grow as a DJ throughout her illness. In fact, he says she DJs better than ever.
Yeah, I definitely think she put her heart into her spinning, and I could tell by, how good she's gotten. And I think a lot of ways when you overcome something like that, it actually makes you better at what you're doing, especially if you stick with it.
RUBIN is now active in several nonprofit organizations. Tamika and Friends raises awareness about cervical cancer. Women open up about their stories to help encourage others battling the sickness. And I'm Too Young for This supports young people who have or had cancer.
I think there's a couple of important messages that we're trying to get out. One is to let the world know that we're here, and if there's any other young people going through any kind of cancer, that there's a whole community and support network that's here for you. Even if you don't have family and friends, we're here for you.
Now RUBIN is cancer-free and back into her DJ groove. The one thing, she said, that pulled her through the darkest time in her life. For Healthbeat Brooklyn, this is Erica Robinson.
That's all for this month. If you want to watch past episodes of the show, go to brickartsmedia.org/BIT and then click on Healthbeat Brooklyn. And you can follow us on Facebook or Twitter on BK Independent TV. Right now, information about the programs and hospitals we've just featured is about to appear on your TV screen. Thanks for watching, and stay healthy.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.